Quite simple topic we have on our hands today is limb trauma and ankle sprain. Regardless of being a physician or not, the limb trauma is very, very easy to spot and very, very easy to deal with, since it's extremely common, not just in the medical practice, but also in general life. The most important aspect of the trauma itself is the history of the trauma. What I'm talking about here is, as a general practitioner, you have to understand what is the site of the trauma, the time of the trauma, and the object of trauma. These questions can be very, very helpful in order to detect how is the limb affected and how is the patient affected. Because you've got simple fractures, you've got compound fractures, you've got so many types of fractures that can happen through different types of trauma. The clinical picture, as usual, we've got pain, swelling, ecchymosis or bruising in the site of trauma, and if there is fractures, we might suspect that this limb is fractured through the limited range of motion. Because when a limb is fractured, or when any bone in the body is fractured, the muscle around the bone goes into a spasm mode, becomes very, very spastic, and therefore the limb or the bone, the joints can't move or hardly move, either through active motion or passive motion. As a general practitioner, we examine the limb through palpation and inspection as well. So, as SpongeBob referred to us, we inspect the limb. When we inspect the limb, we find ecchymosis or bruising, and we might find swelling of the limb. When we palpate the limb, of course there will be tenderness and pain, and in some cases we find this crackling X sensation of the skin. This is we call crepitus. We might find that the movement of the limb is limited, and in some cases, if there is severe fracture and if the fracture completely dislocates the joint from its normal position, we might find abnormal movement. Of course, the investigation of choice is X-ray in all types of trauma in order to exclude any types of fractures. The following treatment is given only if the X-ray is normal. However, if the X-ray detected any type of fractures, that has to be referred to the orthopedic specialist or the orthopedic clinic in order for fixation, a reduction and fixation of the limb for complete recovery. Now, a quick disclaimer: all the medications presented in this slideshow is attributed to the Egyptian market. So these are the medication used in the Egyptian market, since I'm from there. If there is a GIT problem in giving analgesics, easing of pain and muscle relaxants, we usually give them intramuscular administration like Voltaren or Anticox. These medications the main goal for these medications is to alleviate pain and cause muscle relaxation in order for the patient to feel at ease. All these medications are non-steroidal anti-inflammatory drugs, and in medical practice we usually give one gel or emulsion, one gel or cream to apply in order to alleviate the bruising, and one oral medication in order to alleviate the pain and cause some muscle relaxation. Now we move on to ankle sprain. It's one of the most common injuries in sports and in overall general population due to excessive or bad distribution of body weight, therefore causing an ankle sprain. Now, the exact same history of limb trauma. However, there's a very distinctive area that we need to talk about: the tender point. The tender point in the ankle sprain is usually around the lateral malleolus, as the tendons there are very, very weak, and therefore the damage. This is the most common place where damage is caused, and therefore the ankle sprains to the lateral malleolus, causing the damage in the tendons around the lateral malleolus. Now, of course, ankle sprain is very, very easy to diagnose. However, we have to exclude any fractures by x-ray. That's why we perform x-rays even during ankle sprains. The treatment of ankle sprain is usually, we have two types. We've got RICE, adding on analgesics and muscle relaxants. RICE is an acronym that stands for rest, ice, compression, and elevation. The patient has to rest. Rest his lower limb in order to access full recovery. Now, a quick note: full recovery of an ankle sprain takes about 4 weeks, and we have to apply ice, cold compresses 3 times for every 15 minutes for 2 days, especially after the sprain itself. This is in order to reduce inflammation. Compression to allow the limb to stabilize, and then elevation, of course, during or at the moment of the injury in order to decrease the swelling. To ease off the pain a little bit, we apply analgesics, especially oral analgesics like brufen, and we might apply anti-edematous or anti-inflammatory drugs like Ofin gel or alfentra.